Welcome to the show. My name's Ian Sturgeon. I'm here with Dr. Shumon Rahman of Desert River Family Medicine. And I just wanted to have him on the show today because he has a very unique approach to medicine. And he's going to talk a little bit more about that. And then we're going to do just sort of some random topics, things I'm curious about. And I think he's going to have a lot to offer here. So why don't you tell me a little bit about how your practice is different?
Yeah, no, thanks for having me on today. Dr. Rahman, or Shumon casually, is my middle name, what I like to go by. Just a little bit of background for me. So got into medicine via medical school at Tulane. I graduated there from 2012, then joined the Air Force as an Air Force physician for the next 4 years. So it's from 12 to 16 out of Travis Air Force Base. Then basically joined an academic practice after my Air Force time. That was in Memphis, Tennessee, University of Tennessee there, teaching family medicine. So that is my board specialty, is family medicine, which basically is what it sounds like. So I take care of all components of the family, children used to deliver babies all the way through kind of what we jokingly say, cradle to grave kind of medicine. So definitely take care of all ages and stages still. I've stepped a little bit out of hospital and obstetric, delivering babies care. But again, really maintain that full spectrum practice. Here in Colorado, I've really shifted my model, as you sort of said, away from what's generally known as fee-for-service, insurance-billed medicine, right? So we do something called direct primary care, which is, again, sort of supported by my academy, not something I necessarily invented, but sort of doing in my own fashion here. This looks like a monthly service fee to see your doctor, so you get access to me, text message, email, any communications there are all covered through that monthly service fee. The only additional cost to your care are things that have some additional costs themselves, such as drawing blood work, doing some radiologic studies, things like X-ray, CAT scan, ultrasound, MRI, and then medications, right? Many of which people have discovered is actually cheaper to obtain through my contracts than through their insurance contracts. Couple reasons I jumped into direct primary care. I'd say for a long time, basically from the time I left military medicine, I've really seen a lot of shortcomings with our, especially primary care. The way that it's administered practically through insurance programs is I will just tell people, almost non-existent. You can't even look for a medical problem until you have a medical problem, right? These insurance policies want something like a medical necessity code in order to justify blood work. You have to have sort of a billing code in order to even see the doctor, right? So if you've been seen for wellness that year once already, that's it. That's all you get, your 20 to 40-minute visit for wellness. Please don't see your doctor again for that, because we can't bill for your care any longer. Right. So again, what this model really allows is to shift from sick care, what I call kind of sick care, not health care, right, to something that looks more like health care, or actually wellness-based care that expands health rather than just treating illness. And like I said, I think we could do this more effectively if we had the freedom between patient and doctor to sort of, one, just discuss these things, two, have a way to actually make my profession of doing that, right? And three, not sort of give these, artificial markups, let's say, to things like labs, radiology, medications, right? To almost sort of not only just fund the whole system, but also in some ways, I think that functions as a paywall, essentially, right, to not allow people to access these services unless they say it's, quote, medically justified.
Right.
Yeah. So I could expand on that a little bit more. I think that kind of catches some of the nuts and bolts there, of what that, how that's different, let's say, from most other physicians that a patient has seen.
Yeah. So hearing you talk about, having blood work drawn, things like that, what are the, if you had to recommend a few basic things that you feel like everybody should kind of have fairly often and keep their finger on the pulse of in terms of health, like what are some of the common tests that would look different with you versus a doctor who, you only go when you're sick and maybe you have one listen to you breathe visit.
Sure.
Yeah.
Yeah, no, so that's a great question. So I'll sort of share some of my resources and role models here, right? So I think a lot of what I do is based off of Peter Attia and his practice. He's got a book out, Live, a great podcast called The Drive. So very, very much give him a shout out and very much call him even a role model, right? So the spin I have, I think, on medicine has been referred to as maybe longevity. But I think I'd like to expand on that word a little bit and then answer your question. So the way I think about healthcare is, how do we age in the healthiest way possible, right? Longevity, people sort of hear the word and think, well, I'm going to give you some elixir fountain of youth and you'll be 20 till the day you die. And that is not at all what I'm after here. And nor do I think that's practical or even possible today. So really what that means to me, right, is that we have to account for the natural phenomenon of aging and then sort of use this mindset of backcasting to say, okay, we know that aging commonly comes with 4 major diseases, right? So those are heart disease, cancer, neurodegeneration or dementia, as well as insulin resistance or type 2 diabetes being kind of the main manifestation of that, right? So then the labs I get are exactly tailored to assess those 4 conditions, many potentially years prior to symptom onset. So a normal lab panel might include something like a blood count, liver, kidney, thyroid, cholesterol, right? And it may sort of stop there, okay? So things that I do that would be included, let's say, in basically everyone's yearly blood work, unless they sort of say, hey, no, I don't want to pay extra for labs, would be something like an apolipoprotein B, which is kind of a totality of LDL. I check some specific cholesterol markers like what's referred to as Lp(a). So I do a little bit of expanded, let's say, cholesterol markers. Again, cardiovascular disease, 30% of all deaths on Earth, right, should really be high on my priority list, I think, if I'm trying to prevent death from the most common causes. Cancer screening, where I do things a little bit differently, we could, again, kind of talk about some tests like Gallery, which is a liquid biopsy, whole body MRI, more often colonoscopy. So again, we could get more aggressive and more creative with cancer screening. Neurodegeneration, there are some labs like ApoE gene, which is a genetic predisposition to dementia, as well as, again, insulin resistance is strongly tied to neurodegeneration. Homocysteine, which doesn't get looked at as often, uric acid, maybe some vitamin levels like B12 folate, vitamin D, things like this are things that I will routinely order that I do not see necessarily ordered, especially on maybe a young, healthy patient without complaints.
Okay.
And then finally, in that insulin resistance category, everyone gets a fasting insulin level. Many people know about an A1C. However, a fasting insulin level is readily cheap, can be just added on with all these other labs, and can tell us about insulin resistance well before, let's say, an A1C or blood sugar glucose change.
Okay.
Yeah.
That's one of the things that I hear a lot is that that Americans are not metabolically healthy, right? I heard a statistic, and I don't know the source, but I don't know if it's true or not, but that only 12% of the American public is actually metabolically healthy.
Sure.
And so, for one, do you feel like that's accurate? And for two, what are maybe some of the symptoms that people should look for? Like, say I'm, a tall, skinny guy, but maybe I could still be metabolically unhealthy. I don't know. But what are some of the symptoms that people see? How does that affect your health?
Great.
Yeah.
So let's, I think it's important to define metabolic health, right? I think, again, definitions are not always everything, but they give us some boundaries so that we can understand things with more ease. And so to me, metabolically healthy means a lack of insulin resistance, and again, you could maybe even split up metabolism and nutrition, right, slightly differently in there. So what I'm talking about is metabolism might, some people might include, let's say, vitamin levels, whereas others might say, well, that's more of a nutritional deficiency than a metabolic issue. If we're talking about pure metabolism, I think the things that come to mind are your blood pressure, your waist circumference, your actual cholesterol levels, specifically things like triglycerides, HDL, as well as the ApoB marker we had talked about, and then sort of insulin sensitivity markers, which would include things like fasting insulin, a blood glucose, and then they sort of look at your liver enzymes to see if that might represent something like liver fat, right? So the lack of liver fat, low insulin level at fasting, a lower blood sugar under 100, a normal blood pressure, and then waist circumference is sort of dependent on male, female. But generally, let's say for a man, sort of, I want to say 36. Again, we could verify that number. And then for a woman, it would be a little bit lower there. So that's kind of the definition, right? So if we use this definition of metabolic syndrome and then apply that to the U.S. population, that is about the number I've heard quoted, maybe a little lower than that as far as unhealthy, right? 60 to 70% of our country meeting at least 2 to 3 of these metabolic syndrome criteria, sort of defining that as metabolically unhealthy. The interesting thing about this is that this can occur at a variety of weights, right? So you did not hear me say weight in that equation, and that's an important feature that's missing from that definition because, again, an absolute number as a weight, spread across a diverse population is almost meaningless.
Right. Like somebody's a bodybuilder,
Sure.
Right. Yeah.
And, or as you mentioned, kind of tall, skinny person, right? So tall, skinny people can have insulin resistance and short, plumper people can have no insulin resistance. And so, again, kind of coming back to the importance of blood work a little bit, some things can only be known through blood work. Once you start to have symptoms, which is another part of the question, right? So that might look like, so this is kind of an interesting concept, right? So the metabolism becomes unhealthy because it's been burdened with too much energy, too much nutritional energy, calories, let's say. Okay, and then the metabolism says, okay, I've got enough calories to support my biological processes. I need to then store this into fat. Right? Once that also becomes overloaded, now you have a serious problem. Now blood sugar starts to rise and we start getting diagnoses like type 2 diabetes. However, well before that, people can notice a variety of different things just from insulin resistance. Again, blood pressure could rise, energy levels, the way you feel would actually be depressed, right? So that's the counterintuitive part. You're sort of overloading the body with calories, yet you feel less energetic, right? Again, there's some sort of biomarkers like triglycerides rising, insulin rising, liver fat, which may be represented through ALT, for example. But sort of just how do you feel? Maybe low energy, poor sleep, maybe you feel kind of food hangovers, like wake up with some indigestion, irregular bowel movements. Again, just a lot of dysregulation. This can look a lot, even mental health, right? There's a newer field of metabolic psychiatry that really advocates that, look, metabolics is very important to mental health as well. So this might look like even pseudo ADHD type symptoms in some people, or maybe just plain bad mood or irritability. But really, again, the point of this, I would say, is that it can affect almost every biological system, right? All your cells of your body need energy, right? And when that is not happening in an efficient fashion, you can get symptoms of almost any system of the body.
So in the whole, that same area, I was curious what your thoughts are on Ozempic. Like, I'm always for, if I can not take a drug and get healthy in some way, anyway, like I would be almost desperate to not take a drug, especially one that I have to take for the rest of my life. So the question I have is, what is your take on Ozempic and whether that is a good intervention for some people? Can you use it as a tool to get healthy and then get off of it possibly? Are there negative impacts? I hear some things about like muscle loss as well as fat loss.
Sure.
So I just wanted to get your thought on what's best practice and is there a place for it?
Yeah. I think just kind of as a primer to that answer, I'll say that in healthcare, many people are looking for sort of black and white answers that might apply to everyone. And I think that is just a sort of dangerous mindset, right? So I'd say that one of the things that's a big part of my practice is really becoming personalized with medicine, right? So we're going to base this on your labs, your desires, your wants and needs, and whatever your values even, let's say, right? So that's kind of in that background, I'll sort of answer this question, right? So GLP-1 agonists are what these drugs are as far as a larger class. So Ozempic, Trulicity, Victoza, Byetta, several different choices within this category. Mounjaro, which is sort of slightly different in that it also involves one other gut hormone. What these drugs do is mimic a natural hormone in the body called GLP-1 glucagon-like peptide 1. Some of the effects of this hormone, largely in the weight loss arena, are really exerted through brain biology, right? So we've learned that this is largely a central effect of very strong appetite suppression. So GLP-1 is created in the gut by the microbiome, by the gut itself, is created by intake of, let's say, like high amounts of chlorophyll-containing plant leaves can actually increase GLP-1 modestly. There are even some probiotic products out there that, have some research to support that they increase GLP-1. But then to dive into kind of the Ozempic type products, right, I think that for the right person in the right situation, with the right support, these can really be fantastic medications for people. We see amazing results, and sometimes, again, there's this thought right in medicine of, sure, we want to engage in healthy habits and sort of build, that pyramid of health the right way. But, if you're so overweight and thinking about food all the time and constantly stressing about this and have struggled, failed 15 different diet programs or just regained the weight, let's say, not necessarily failed, but lost and regained, yo-yoed around, right? Can this be a tool for a temporary period of time to really help you feel a little better, right? Get some of that weight off so that you can take a walk without your knees hurting or your back hurting, so that, again, you can show yourself, hey, I can live without ice cream every night or eating the entire pizza or whatever it is that might be your barrier. Again, I think these drugs are great when used with the right mindset. What worries me, right, is that instead of doing any of that other stuff, let's not change our exercise habits. Okay, fine. I'm not going to eat the whole pizza because I'm been chemically blocked, from an appetite standpoint. But I've had no intention of changing that habit, right? The data would support that as soon as you stop these molecules, you will regain all the weight, right? And that is sort of the troublesome part of this. To address some of the muscle loss and heart rate increase, those are the two things that I think I've heard most about. Increase in resting heart rate is sort of a worrisome sign. Let's just say, again, if you know anything about some sports physiology, resting heart rate is very telling of recovery and sort of stress and some other markers there, and even cardiovascular fitness in some ways, right? So a rise in resting heart rate, which is usually associated with the negative of those things, would be, again, concerning. We have no evidence to know that Ozempic's or, again, these GLP-1s rise in heart rate leads to more heart disease or anything. But I'd say from just a, not knowing standpoint, it's concerning.
And it's fairly new, right? So we very really know what 40 years of Ozempic would do to somebody, right?
Yeah. And these drugs have been around, in sort of bodybuilding, other sort of fringe circles, fitness circles, I think, for some time, probably a little over a decade. But as far as FDA approvals, kind of major mainstream use, I would say, has really been over the last 5 or 10 years, especially. Yes, we don't have great long-term data, at least on a wide scale. And then the muscle loss, again, a lot of people feel can be mitigated with a smart plan. Increase protein intake relative to other calories, add resistance training there, to sort of do the things that we need to do to build muscle anyway. seems to help to mitigate some of that muscle loss. But let's say, again, someone's sort of already physically inactive and overeating, and they just add this drug to their life. We do see an exaggerated amount of muscle loss that is very concerning, I'd say, as a doctor who's after that healthy aging. Again, muscle mass and strength as we age are very much associated with good health. So that being kind of the connection there.
Cool.
Yeah.
So I guess the moral of the story is like it should be a tool in your bag, but not like it's not a miracle drug that maybe some people view it as.
I think that's a fair, nuanced look at it, right? I would never say that, do I prescribe this drug? Yes, I do. Do I have, good reasons, I think. And again, if you have severe type 2 diabetes, I think that's a different category of patient. And the kind of risk that comes with that, I think, is very much more than some of these risks we're talking about of these drugs. In the mostly healthy patient is, I think, where that applies very much, right? But if you have severe metabolic disease, type 2 diabetes, is an A1C of 10 safe for you? Absolutely not, right? So sure, the drug may have some risks. But again, I think, this is even research supported that in that population, it does seem to lower cardiac risk, kidney failure risk, a lot of these other things we know that happen with severe metabolic dysfunction.
Cool.
Yeah.
You mentioned something else, and I think you've done you do these doc talks where you dive deep on some of those things, which we won't have time to do here today, but I wanted to get your take. One of the things that you mentioned was neurodegeneration. And from your perspective, I worry about that because my grandpa had Alzheimer's. And so what are some of the ways that you can sort of hedge against some of those effects, and what are some best practices when you're thinking about, because one of my biggest fears is that someday I'll lose my mind. My body may be still healthy, but I'll lose my mind. So what are some ways that you can protect against that?
Yeah, no, great question. What I'd say there is that what is good for the heart is good for the brain. What's good for the heart and brain is a healthy metabolism. So again, just this interconnected nature of health, right? The more that we have sort of hyper specialized in medicine, especially, I think that hasn't served the primary care setting very well. Right. So sometimes I'll get patients say, oh, I'm really concerned about dementia. Send me to a neurologist. Right. And sure, a neurologist, again, I have no problem with just great doctors. I know many great neurologists. However, right, to kind of get to the heart of that question, living in a healthy way is the best prevention. Okay. If I had to rank something as number one, I might say something along the lines of exercise, honestly, a good exercise program. Exercise releases a compound called BDNF, brain-derived neurotrophic factor, which then actually can lead to the growth of new brain cells. So we have research to suggest that even into our 70s and 80s, we can measurably grow volume on our brain through the vehicle of exercise, right? So a close second and third might be things like sleep and nutrition, okay? And avoiding, let's say, insulin resistance, which of those two things are very important. Sleep really functions to be sort of a clean out process for the brain and really cleans out. So some people have heard of these proteins that can accumulate in certain processes like Parkinson's with alpha-synuclein, with tau and beta amyloid with things like Alzheimer's, dementia. Right. What we see is that sleep depriving you for a few nights actually has an exponential increase in these proteins. And then as you sleep better for the next couple nights, right, that we actually have a clean out of these proteins. So it seems to be more complicated than just the accumulation of these proteins, but maybe our ability to clear them, right, might be more important than the actual levels. And that's sort of the way that sleep is vitally important. So about 7 to 9 hours of high quality sleep would be the briefest way that I would put that recommendation. And then in that nutrition category, again, really focused on avoiding insulin resistance. So, that would be minimizing our simple carbohydrates, sugars, starches, added sugars, desserts, grain-based foods, and swapping those things for foods that promote a healthy microbiome, which seem to be kind of our crunchy vegetables. Diversity of plant fibers might be the most complete way that I could say that. And then omega-3s, which seem to be very important for brain health, as well as that protein intakes to support movement health and healthy muscles. Yeah.
Cool.
But I would say that would be, again, we could go on and on about this, and I do have a little bit over an hour of material on that, but those would be probably my big three.
Okay.
Yeah.
Yeah. So some of these questions might get answered the same way,
Sure.
Multiple times, but so I'll cut to the chase a little bit. Like, imagine that I could wave a wand and instead of Robert F. Kennedy Jr. being in charge of making America healthy again, you get the job. Like, so what if?
No, thank you.
Seriously, it's a tall order for sure. But what if you had that job? What would be like the maybe 2 to 3 things that you're like, nail this and you'll get an 80-20 ratio of being a healthy person,
Yeah, and if I could expand that list just a little bit, okay, because I think 2 or 3 might be a little bit too short a list, honestly, if you want a comprehensive plan. So I mentioned exercise. I think about, maybe more on a societal level, sort of allowing, making exercise easy for folks, right? So here in Canyon, we have, for example, on the Riverwalk, kind of an exercise circuit, right? And, again, one of the reasons I moved to Colorado is to be in a sort of, place that makes that more accessible.
Yeah.
Right. So having good trails, parks, places that people can go. I'll kind of plug our recent pool here, a big reason, right, to have that for all ages, right, because of how important this is, maintaining movement health to all aspects of our health. Right. Sleep, I think, is getting a lot of appropriate attention. Again, that's 7 to 9 hours. Nutritionally, I think, again, sort of increasing access. Right. People come in. I had a patient come in, I think today actually, and tell me, hey, I noticed that eating a lot of the foods that you're telling me that are not great for my insulin resistance are sort of the cheap, easy options. Right. So if I were sort of, again, in that position, I would think about how can we shift our current policies to allow the apple and the salad, right, to be the sought after, cheaper, easy option, as opposed to maybe some of our current options of, again, grain-based kind of things and grab-and-go fast foods, etc. A little bit in that nutritional category, I'll say the quality of our food is important there too. So just, again, asking the question, are these pesticides maybe, being overused or other things like that? So again, kind of maybe more to that than we sort of give it credit for on surface. And then a couple things I wanted to add to that list are kind of mental and social health. Okay. We are, kind of tribal beings, I would say. Social interaction is a necessary part of our life. I am not here to say that everyone needs to be a social butterfly, or you have to have exactly 10 friends and talk to them for this many minutes a week or anything like that. I'm just saying we live in a highly social world, and you have to think about, are the relationships I currently have adding to my life in some way? Are some of them taking them, that away from me? Are they affecting my well-being? Do I have no social interactions, which I would say is dangerous as well? But just thinking about, how does the social relationships in my life play a role in my well-being? And then mental health, right? I think something that, again, I've been very happy to see more attention paid to in just general kind of culture and I'll say pop science, but again, mental health very much is super important, if not maybe the most important thing, right? In one of Peter Attia's podcasts, he was sort of asked, why are you trying so hard to live so long if you're so unhappy, or something along those lines, right? And so what's the point of a good exercise program and lowering your cholesterol and preventing dementia if you're just miserable the whole time, right? right? So finding a way to be content, to have some peace, have a sense of purpose in your life, right? I think those are essential parts of mental well-being, or the health in general, let me say. And then the last one I think would be sunlight, right? We work in these indoor spaces that sometimes don't have windows. We don't, there's sort of the corporate culture sometimes is work, work, work. You shouldn't take breaks. Why do you need a walk? So again, just including some of this in our day. Why can't an office place have an hour in the middle of the day where everybody goes outside and does some exercise, right? It would make them more productive. It would help prevent a lot of the chronic diseases we're talking about, right? And ultimately, if all you care about is that bottom financial line, I think there's a lot of data to suggest that it would, in fact, increase, productivity.
Right. If everybody didn't hate their lives, it would.
Now, again, in Europe, they work 32-ish hours a week, right? Sure, their GDP and, other markers might be slightly lower. But I don't think people think of, England and France and Italy as like really terrible, poor, hard life, kind of terrible places to visit and live. Right. So there's something to that, too, that, are we sort of just accepting our workaholism? I would say to some degree, yes, right. We've sort of built a culture around that. Slowing down and, just appreciating life, I think is a big part of that, too.
Yeah. Yeah. So much of all of that is all connected, right? Like if you go to the gym and you have relationships there, or you walk with someone in the sunshine, and it's just like it's all,
stacking, right?
Yeah.
Sort of that's referred to, but absolutely, right? That is in our busy, fast-paced life. I am not saying don't be efficient. I'm just saying think about how you can include multiple layers of this.
Yeah, and that's a good point, because so many people get overwhelmed with, I don't have time to do this, and this, and it can be, man, you're thinking about like if you want to refine your health, you're thinking about, I got to rinse all my food and get all the pesticides off, and I've got to get it, it's like, it can be
overwhelming for sure, and again, I think, kind of keep it simple, stupid type thing, or, back to the basics kind of thing, right, would be, am I eating real foods? Am I moving some out throughout the day? Have I, had a kind interaction with someone today? Did I see the sun today? Right?
Yeah.
Do I prioritize sleep? Do I even give myself the time to sleep appropriately? Right? And then again, combining these things, right? Okay, I don't have an hour for a workout in the gym. Right. Fine. Well, do 10 air squats with a buddy in the office, or go up and down the stairs, or just go outside for, 10 minutes. And again, sitting in green spaces, even just sitting in a park, has been shown to release our natural endorphins, kind of feel good, compounds. Right. So I think we get too tied up, and I can't do the full level of what I'm doing, so I'm not going to do anything. A much healthier mindset would be, you got 2 minutes? Okay, do it. Right.
Yeah, 100%. I saw this video the other day that was just talking about how much a few air squats before or after a meal affects your blood sugar spike. And you don't think like, I guaranteed you're not going to, maybe you don't go to the gym that day, but if you did that, it would still affect your health in a very positive way if you just got a little bit of movement, these little snacks of working out.
Yeah, so, and that's exactly the term I use too, is exercise snacks. Right? So rather than reach for that actual snack, right, what may actually help your energy more is to do that.
Yeah.
Right. And I think, again, kind of proof's in the pudding, right? So you don't have to believe me, right? Go and do some of these things and see how you feel, right? What I tell people is, I'm yet to see the person who says, Doc, I switch from rice to broccoli, and, I do some air squats throughout my day, and I sleep an extra hour at night, and I have some better social interactions, and I hate you. My life is miserable.
Right.
Right. So that's not what people say, right? They come back and say, I never knew I could feel this good.
Yeah.
Right. Sort of thing is much more often what I hear when those people do those things.
I was going to ask you about that. So it's a little off of my list, but
sure.
Do you ever say somebody came in, they're like pre-diabetic, say, and you say, hey, these are all the things that you could be doing. Do you ever see somebody who does everything you tell them to, and they still don't move the numbers in the right direction, and they end up being on a medication, even though they're 100% in and they're doing everything that you've asked them to do? Is that a common thing, or like?
I think something along that line definitely happens. I think a lot of, maybe some people listening even might have experienced something like this. I'd say the most common arena in which I see that is maybe, again, that pure weight loss kind of goal.
Mm-hmm.
Right. So most people, if they're really following through on the dietary changes, making a little bit more efforts with movement, fixing, again, even a couple of those components, we're generally going to see like a blood sugar come down, an A1C come down, other things of that nature. Right. Does weight always come down? No, I'd say a lot of people get frustrated with that. What have I made of that situation, right? I don't believe at all that people are coming back and lying to me or not giving effort or anything like that, right? I'm mostly an optimistic person, really trust that people are, again, if you lie to me and I'm your doctor, then it only really hurts you. But anyway, so what I find is that I think culturally, we've had an attitude of I should be able to eat a standard hamburger or whatever, this meal that I bought, the plate that they gave me, right? And when we add up those calories, maybe that's, again, 1,800 calories, maybe again, under that 2,000 number that people kind of have in their head. Well, that's not true at all across the board, right? Every person has a different amount of calories that they can eat that will keep them at a steady weight, keep them out of insulin resistance, et cetera, right? So I think a little bit of acceptance goes a long way. Hey, if I'm eating in a certain way, exercising in a certain way, and not meeting these criteria, right, then that is your body telling you you haven't met the right threshold. I find it hard to believe that there is nothing that could be done to then get the changes desired, right? I just think that sometimes what is required is asking a lot of people.
Right. Yeah. And, I feel I've had people call like a whole food diet like an extreme diet, right? And it seems more extreme to me to eat things that aren't food, right? That's extreme to me. And B, maybe it is extreme, but our American diet is so extremely unhealthy. You've got to do something fairly extreme to negate those things, those abuses that we've done to our bodies through living in our culture. We've got to do something to work that out, and if the math just doesn't work, it's just, you got to do.
The other thing that kind of comes to mind here is the sort of scarcity loop, as it's referred to in the brain, right? This is some of Michael Easter's work. I believe that's the name of the book, Scarcity Brain, something along those lines. But basically, right, these are sort of the quote unquote addiction reward kind of circuits that people talk about, right? So a slot machine, for example, really utilizes this action within our brains and bodies, right? Of if we have sort of a variable reward schedule, it's easy to reproduce, and we get, again, this kind of cocktail of things has been sort of cooked into our food, as it were, right? And these food products, I think, prey on parts of the brain that are there really for a world of scarcity that doesn't really exist in a lot of ways anymore, right? So in a previous world, I think if we view this through the lens of evolutionary biology is what I'm trying to say here, I think it makes a lot more sense, right? Because how do we make sense of this, that, okay, I know this food may not be good for me, yet I can't stop consuming it, right? That really speaks to that there's probably some powerful biology behind it. And so I kind of point this out to people, not to give them an excuse to just behave the same, right? But to point out to them that, look, like trying to tell yourself, I'm going to have one bite of ice cream and put it down, is really dangerous. Not because you don't have willpower, but because your entire brain and body is really built to push you to eat that rest of that ice cream.
It's saying like those are calories that we can use later.
Right.
Let's pack this on, right?
And again, I mentioned again, a third of people die of heart disease. Another 20% of people die of cancer. Another maybe 10 to 20% of people die of neurodegeneration, right? Go back 1,000 years, not that long ago, right? And that list looks like infectious disease and famine as number 1 and 2. Okay. And again, just to illustrate how much our world has changed, right? If you die of pneumonia, that's almost like, how did that happen? How did you die of a whatever basic infection like that? Right. And that was very common cause of death over the years, right?
Yeah.
Right. And now we've sort of shifted to these diseases of excess per se. And part of that is modern medicine. We have antibiotics, we have procedures that can cure a lot of those other diseases. But part of that is, again, I'll admit, right, we have basically fixed starvation. The famine doesn't really meaningfully exist as a cause of death on Earth, and that's great. That's a miracle in itself. However, it came with this maybe other problem, right? And again, kind of connecting that back to what are we, right? We existed in this world of not enough food, and most of our systems should have been built in a fashion for our survival to really capitalize on those easy calories. So I just tell people, it's not your fault. You're a human being. You're built this way, right? If you want to eat less pizza, maybe not starting with the first piece is a better policy than expecting yourself to be able to control this. I think is very... I think it's just putting too much. I think we put ourselves on a pedestal to think that we can just overcome our basic biology. And I don't find that to be true.
Yeah, I feel that the same way. Like, it is much easier for me to eat 100% strict than for me to eat in moderation. It's like it's one or the other for me,
Sure.
And maybe I have an addictive personality, but that's just how it tends to play out.
And of course, we're all on different areas of that spectrum. I think it is definitely a wide spectrum there. So sure, some people can get away with that and do just fine. And again, that's where knowing yourself, right, is so important in one's health journey.
Yep. Yeah. Cool. Well, one of the I'm of a certain age where people start talking about testosterone replacement therapy.
Sure.
I wanted to get your thoughts on that. There are a lot of, from what I understand, there are clinics that everybody who walks through the door suddenly has low T, and you can get, they just pass it out like candy. And so I was interested what your take is. Are people abusing it? Is there, what levels are really our optimum? And I know that changes some with age, but
Sure.
What are your thoughts on testosterone replacement therapy?
Yeah, so testosterone, again, just a little background there, major kind of sex hormone of both men and women. This is kind of a fun fact, right, that the absolute level of a woman's testosterone is actually higher than her estrogen. The same is true of a man. And actually, a man generally has a higher estrogen level than a woman. It's just that both of those levels are much higher in a man, whereas, again, it's more this ratio of testosterone to estrogen that sort of specifies maybe more male-female characteristics. So with that aside, again, we'll focus a little bit on kind of male TRT, testosterone replacement therapy. So as we age, there is a natural decline in testosterone that is to be expected, to address kind of absolute numbers. With many of these hormonal systems, we really want to base things on how you feel more than absolute levels. There, I would say, however, for me personally, I do feel that pushing everyone to the upper limits of normal or kind of upper limits of the population on testosterone doesn't quite make sense to me. Right. Again, I mentioned some personalized medicine kind of principles here, and I think that really apply in this arena. So no, I don't have a sort of absolute level I'd shoot for. Yes, I think it's a real thing. There's some research suggesting that maybe, again, environmental toxins may be at play here of why we're seeing such higher rates of especially males with lower testosterone. Phthalates and a few other things have been sort of proposed there as potential toxins doing this, endocrine disruptors, they're sort of referred to. I do think it's been abused, a commonly abused, medication, drug, hormone, however you want to kind of think about it. For some, again, potentially, performance reasons is probably the main thing. Testosterone is sort of the hormone of making work feel good, right? So you can imagine why this is abused, right? Not only does it help with getting more out of the gym and sort of performance medicine on a physical aspect, it can actually help with mental performance as well, right? People tend to have a little more motivation, maybe more mental clarity, some of those types of things. So those are the sort of potentials of why it would be abused. As far as it relates to general health, I think it's an important hormone to look at and to try to optimize. That doesn't always mean you're going to take testosterone. Poor sleep causes low testosterone. Not enough protein intake causes low testosterone. No resistance training or physical activity causes low testosterone. So again, many modifiables in your life where we could look at raising testosterone through non-testosterone replacement means. And that's where I really start with people, or even some nutritional supplements. Sometimes DHEA even can be involved in testosterone production. And again, that might be more in women than men. However, again, these are sometimes over-the-counter supplements or just lifestyle interventions that we would use first, right? And then if that doesn't really work and we have significant symptoms, then I do think that even a lifelong, testosterone replacement regimen is something that I think there's good data to actually suggest could support longevity, again, in the right patient.
Right. Yeah. And, just brainstorming while you're talking, you think about if you compare our testosterone now to back, to even maybe 100 years ago, or I don't know when they developed the test, but it's gone down. They have data on that, right?
Correct.
But, you look at what people were doing back then, there was much more manual labor, much more outside work, a lot of
population too, right? People died earlier. So
yeah. Yeah. So a lot of those things, we keep going back to those big things of getting exercise, resistance training, sunshine, all of that.
Yeah.
I was thinking about sunshine and vitamin D and our, the lack of ability for us to get vitamin D during certain times of the year here in Colorado. And it made me think of, are there any supplements that you think that like pretty much everybody in our society today could benefit from that? Obviously, have those conversations with your doctor, but Absolutely. Are there any supplements that you're like, like pretty much everybody should be taking that?
Yeah. I mean, I think, kind of on a high reward, low risk kind of ratio on supplements. I put creatine high on that list. Creatine monohydrate seems to have great evidence for both kind of physical performance as well as actually cognitive performance, brain health. I'd say omega-3s sometimes, especially if your diet is not rich in marine protein sources, where a lot of our sort of essential omega-3s come from, the ones we can't make in our bodies, what essential means. So I think, again, a supplement there could be warranted for sure, unless you have very high fish intake. And then, again, kind of, the list isn't terribly long for me. I think vitamin D3, K2, something like that. Again, most statistics would really support that we're not outside enough to generate as much vitamin D as we need for optimal health. So most people are going to be at least on the lower end, even if they're normal. Again, I don't know if you consider like protein a supplement here, but, I'd say a lot of people find it hard to get adequate protein intake without using, let's say, a, protein powder or something else of that nature.
Yeah.
And then just thinking about, hey, look, if I'm not getting enough kind of leafy greens and other things like that, can I take sort of a vegetable powder or something to support a microbiome? I think that could be a very reasonable kind of thing that provides just an array of different vitamins with some plant fibers. Make sure, again, it does include some fiber in there because that would be an important component. But again, I would say, my list probably stops about there, for everyone. And then everything else there, I would really say, I think of this as, why am I doing this, right? I need to have a target for my intervention. And even better would be, I need to have a measurable, right? And again, that could be as simple as a subjective check-in, or it could be as sort of objective as, let's say, a blood draw, right? But thinking about, why am I doing this? is there something I can measure, even if it's subjective, right? And then do that for a month, right? Stop maybe for a little while and then restart and sort of track that. Right.
And there again, that's the benefit of having a doctor who's interested in interventions before you're sick and monitoring these things and taking blood work instead of just showing up once a year and say, how am I doing?
So many people don't even know you can do something called an omega check, right, which tells you about how much omega-3s you have in your body, right? So there are some ways to check some of this stuff, and sometimes it gets put in the realm of functional medicine, which is not necessarily an official board specialty. But again, I would say that, yeah, sure, I draw from some of that body of work, but I wouldn't necessarily label myself as sort of a functional medicine doctor. But I think that section of medicine does have some things to offer to the rest of mainstream medicine. So
great. So that'd be a good place to maybe end it. We've got some supplements we want to shoot for. And we've talked about like getting exercise, getting sunshine. What do you see in terms of diet? I like I said, I've always been somebody who's sort of aimed for paleo eating. That's totally revolutionized like my life.
Sure.
But then you see people who are vegan or they're carnivore and they're saying the same things like everything changed when I started eating like this.
Right.
So what are your thoughts there?
Yeah. I think, again, you've sort of heard this as a theme that while I think we all share a lot of certainly biology, genetically, we're very similar. Again, that small amount of diversity, however, seems to make a really big practical difference. And I think that's what we're seeing in the nutrition world is that each of us probably has a unique genetic makeup. And then on top of our own genes, we have, 1 billion to 1 trillion other players in our gut, mouth, nose, skin, right? That all sort of, so this is the microbiome I'm referring to, which is more than just bacteria. It's actually viruses, fungi, protozoa, all sorts of stuff, right? So, that's what I think accounts for some of those differences of why would one person feel great on vegan, whereas someone else would feel just as great on carnivore.
Right.
And if you switch those people, again, maybe they both feel like crap. Okay. And I think that could be real. Again, I'm not going to deny people's experiences. So that would explain maybe my best theory on why that happens. Right. So, nutrition is sometimes like becomes like a tribal religion kind of, arena. And so here I would say is, look, there's a variety of diets that I think have good evidence for them. Paleo, keto, vegan, Mediterranean, to name a few of those sort of named diets, Whole30. What I tell people is eat real foods, right? Include more one ingredient foods in your life.
Yeah.
Right. What's in one ingredient food? Again, what does an apple have in it other than maybe the food wax that's on top of it?
Right.
Basically nothing other than what you would call an apple, right? A carrot, a celery, or chicken breast. Okay. I'm not saying don't put spices or, you can't use a sauce or something else like that. I'm just saying, what are the staples of your diet, right? And is that ingredient list a bunch of things you can't pronounce?
Right.
Then maybe include a little less of that in your diet. And again, not saying never, but less for sure.
Yeah.
So I think there is good evidence that ultra processing seems to be worse for us. So that again sort of ties into that one ingredient or real food kind of concept.
Yeah, and that's what struck me about all of it is a lot of those diets are like you look at them and it's because you cut out all the junk that's in food, right? So maybe you're only eating meat, but you're also cutting out all of these highly processed, these food additives, all of that. And so everybody's like, oh, I feel great when the kind of the line running through all of it is, well, you're eating whole foods. That's why you feel great, whatever it is.
A version of an elimination diet, right? Like you're saying, you're eliminating so many things out of your diet, right? And that seems to be something too, right? That the variety of food seems to be something that, let's say, like there's good evidence that it definitely drives weight gain, right? So they've looked at sort of these older societies that haven't been as affected by modern, economics, and they have. Again, you can walk down, even in Canyon City, you can get food from across the world, right? So, I think there is good evidence that it definitely drives weight gain, right? So they've looked at sort of these older societies that haven't been as affected by modern, economics, and they have. Again, you can walk down, even in Canyon City, you can get food from across the world, right? So some of these cultures only eat like 4 or 5 foods.
Right. It's like all they eat all day is fish. So,
Right. And, again, they almost have no obesity, type 2 diabetes, cardiovascular disease. A lot of these things are non-existent in some of those societies. And is it that, oh, we should all be eating this one kind of fish or just potatoes all day long? No, but I think, again, that's part of what we found, right? I think the best way I've heard it sort of summarized is that the more variety we allow ourselves, we just tend to overeat.
Yeah.
Yep. So cool. Yeah.
Well, I know you got a busy day. It's been a busy day for you already, so I'll get out of your hair. But I really appreciate you coming on the show and just sharing your experience with us. And I'd love to do it again sometime if you're open for it.
I'd love to return. And again, I think one of the things that's lacking in our world in primary care is just reliable health education. I'm not here to say that I know everything or that I'm not going to be wrong some of the time, but I think the more that we can all engage in these types of conversations, that really helps to make all of us healthier as a community. So I'm glad to add to that library.
Awesome. We'll see you next time.
All right. Perfect.
Thanks for watching.